Greetings of the day. Today we are going to discuss about the signs suggestive of intimate partner violence. So the intimate partner violence is often cyclical in nature. The cycle begins with the period of tension building, which includes arguing, blaming, controlling behaviors, or jealousy. The next phase is escalation. Escalation in terms of like there will be verbal threats, physical and sexual abuse or assault. Weapons may be used at this point. Sometimes there may be honeymoon phase where the perpetrator may apologize or make excuses for inappropriate behavior. Over time, the abusive behavior tends to increase in the severity and the intervals between the abusive episodes become shorter. So there are no usual features, but there are some suggestive. We are going to discuss about that. So the signs may be suspected by the behavior of the partner. The abusive partner may be defensive, hostile, and aggressive and might demonstrate controlling or overly solicitous behavior towards the patient. The patient may appear frightened of the partner or refuse to answer questions and instead defer all responses to the partner. In situation raising concern, and if the patient agrees, hospital security can prevent the alleged perpetrator from visiting the patient at the ED and hospital. So the health consequence of the intimate partner violence in the respective age groups. In children, you can find if the children are abused, there might be low birth weight, prematurity and associated complications can be seen, and failure to thrive can be seen, and parental neglect syndrome, speech disorders, bedwetting, headaches, cognitive functioning problems, lower verbal and quantitative skills, psychological and emotional problems, aggression, hostility, withdrawal, acting out, child abuse. These are all the features seen in or the consequence of the abuse. And in adolescence, we are going to discuss adults first, then after that. Okay, so adults, there will be injuries, alcohol and substance abuse through distract from this abuse and to release the stress out of this, and there might be infection because of this abuse, HIV infection, PID, pelvic inflammatory disease, UTIs, vaginal bleeding, unintended pregnancy, headaches, chronic pelvic pain because of sexual assault, back pain, eating disorders, GI disorders, depression, anxiety, difficulty sleeping, post-traumatic stress disorders, substance abuse, homelessness, social isolation, suicide, and death. So in adolescents, it will be same as adults, and there might be victimization as adults and fertility problems, poor school performance, school dropouts, unwanted pregnancy, and the associated complications of the pregnancy, obesity, behavioral disorders, involvement with the legal system and codes, and risky sexual behavior, prostitution, and alcohol and drug use. So the signs suggestive of the intimate partner violence include there might be injuries characteristic of the violence that might be fingernail scratches, broken fingernails, bite marks, dental injuries, then black eyes, broken bones, cigarette burns, bruises suggesting strangulation or restraint, and rope burns or ligature marks may be seen. Injuries suggest to a defensive posture. Forearm bruises and fractures may be sustained when individuals try to fend off the blows to the face or chest. Injuries during the pregnancy. Up to 45% of the women report abuse or assault during the pregnancy. This might lead to preterm labor, placental abrasion, or direct fetal injury, and stillbirth can happen. And you can see the central pattern of the injuries, like injuries to the head, neck, face, thorax, and abdominal genital injuries. Extent or type of injuries consistent with the patient's explanation. Multiple injuries at different anatomic sites inconsistent with the described mechanism. The most common explanation of the injuries are fall. Embarrassment, evasiveness, or lack of concern with the injuries may be noted. Multiple injuries in various stages of healing may be seen. These might be reported as accidents or clumsiness, and a delay between the time of injury and the presentation of further treatment may be seen. Victims may wait several days before seeking medical care for injuries. Victims may seek care for minor or self-solving injuries. And there might be visits for vague or minor complaints without evidence of the physiological abnormalities. So there might be subtle thing, subtle skill that requires in these cases that because the patient might have a frequent ED visits for various type variety of the injuries or illness, including chronic pelvic pain and other chronic pain syndromes. Suicide attempts. Women who attempt or commit suicide often have a history of intimate partner violence. This concludes this video. Thank you very much.